Hello, and welcome to the Foot and Ankle Surgical Associates Patient Educational Series. This video will discuss the use of the ice machine for ice therapy following your surgical procedure. The ice machine is a self-contained system which uses hoses and pads to circulate ice over your surgical site. It consists of a cooler unit, a hose that connects to the ice pad, and the ice pad itself. The ice pad will be placed over your surgical site at the time of your procedure by your Foot and Ankle Surgical Associates physician. It is important that you do not tamper with or remove any bandaging unless instructed by your physician, as the ice pad circulates very cold water and without the proper barrier can cause damage to the skin and surgical site. The purpose of the ice machine is to provide a constant influx of ice water to act as an anti-inflammatory and soothing agent to the surgical site. There are a couple different machines that we utilize here at Foot and Ankle Surgical Associates. However, no matter the machine used, the premise is the same. For our purposes, in this video, we will use the Breg Polar Care Cube as our model for how to use this ice machine. The cooler unit is labeled on the inside of the cooler, showing a line for water and a line for ice. The first step to using your ice machine is to fill it. Fill the machine with cold water up to the line marked 1, water. Then proceed to fill the machine with the ice to the line marked 2, ice. After the machine is filled, you'll need to plug the machine into the ice pad. The hose unit consists of a white end which has 2 female connectors and a coupling unit with metal buttons. The pad will have a hose as well sticking out of the bandaging with 2 similar male connectors. Place the male connectors of the pad into the female connectors of the machine hose. You will need to push until you experience or hear a click. This tells you the pad is securely attached to the hose. You will then follow the hose of the connection to the machine, and just next to the attachment at the lid, you'll see a metal circular power plug. Plug the power cord into this and plug the other side into the wall. When you connect the wall and the power to the machine, it will automatically begin to run the machine. And you're done. Now sit back and elevate your foot and allow the healing to begin. It is a good idea to check the machine contents at about the 5 to 6 hour mark to ensure the water is still ice cold. If it is not, unplug the machine from the wall, dump the water from the cooler, and repeat the steps for filling the cooler with water. Then ice, then plug the machine into the pad, and finally plug the unit into the wall. A key thing to remember is that running the ice machine without water will damage the machine. You must not plug the machine into the wall until there is water and ice in the cooler. Some important things to keep in mind while using the ice machine is that even though you may not feel the cold, this does not mean the machine is not working, and you are still receiving the anti-inflammatory and soothing benefits from the machine as long as the water is still ice cold. Sometimes the bandaging may feel damp. In most instances, this is not a leak, rather condensation from the ice pad. For the most part, this cannot be avoided, as we are placing a very cold item in a very warm and inflamed area. However, if your bandaging is becoming soaked to the point of dripping water profusely, unplug the machine immediately and call the office so we at Foot and Ankle Surgical Associates can remove the bandaging and check the pad for you. If you can visualize a small leak that is occurring, disconnect the pad from the cooler hose by depressing the 2 metal couplings around the ice pad connection. Be sure to fully depress the couplings so the pad disconnects and does not tear. Reattach it in a similar fashion and be sure the pad is securely fit. If this does not solve the problem and the leak continues, call the office to have the bandaging removed and the ice pad inspected. Do not remove your bandage by yourself. It is important that all of the bandaging remain intact until a Foot and Ankle Surgical Associates physician can take it off for you. Again, most of the machines you will receive at Foot and Ankle Surgical Associates are designed to run continuously, so the machine should be on constantly. If the machine cycles off for any reason, this may be because the machine is overheating, and it will reassume when it's able to. it will turn on by itself. If the machine does not turn back on within an hour, check your power plug. Check both attachments, one at the machine and two at the wall, to ensure there's a proper connection. It is important to point out that the machine runs directly off electricity. So, if there is a power outage in your home, the machine will not work. Also, if the machine is not plugged in, it will not work. So make sure you check to be sure that it's plugged in. If your machine continues to stay off and does not show signs of turning back on, or if water is not flowing in the pad, first, make sure there are no kinks in the pad. Gently pull on the blue tube to make sure the tube-pad junction is straight. If this doesn't work, depress both plungers inside the female side of the coupling with a pin or instrument to release any air that might be in the line. Thirdly, if this doesn't still work, check to ensure you have ice water or water and ice in the machine. If you do, then you will need to contact the Breg customer service representative for all Polar Care Cube machines if it continues to stay off. The contact information will be Brad Walker. Phone number is 760-685-2007. If you have a different machine than the Breg machine, call our office for further instructions. Finally, if you have any questions regarding the use of your ice machine, don't hesitate to call your foot and ankle surgical associate's physician for more and further instructions.